Before we begin, I would like to say a disclaimer. The views expressed by myself are those of the facilitator and do not necessarily reflect the opinions of the Uniformed Services University of the Henry M. Jackson Foundation, the Department of War, or the U.S. government. Germany, Texas, Virginia. When I think of Germany, I imagine a long, dramatic staircase with hints of red spiraling up as my family and I are carrying grocery bags up the steps. When I think of Texas, I think of my mother screaming at the top of her lungs for my father because she found a ginormous spider in my closet. And when I think of Virginia, Virginia is Langley Air Force Base. And I imagine and remember a beautiful strawberry field that we passed each time we drove on and off installation. As a former military child, I have a variety of memories of learning new experiences, meeting new people, traveling. But I also have different memories. I have memories of my father being gone on what he called missions, working long hours, working odd hours. I remember my mother being strong but alone, raising 3 children as my father is working hard. And I also have memories of always being the new kid. New school, new home. And every time I felt like I was fitting in, we moved with new rules. And although my story is almost 35 years ago, many military-connected children have the same story. And by most accounts, if you would have asked someone, I probably would have been described as a typically developing child, right? No concerns. But if I'm being honest, I think I would have benefited from seeing a mental health provider because navigating those frequent moves and being away from my father was something that was difficult for me to handle and navigate. And like I said, my story is a long time ago, but so many military-connected youth have that same story. Unfortunately, I was not afforded the opportunity to meet with a provider. And when I think about it, it makes me wonder how so many other youth who may be impacted with mental health, emotional, or developmental or behavioral health needs might feel when they don't have a provider to reach out to. And I want to take a step back for a second. When we're talking about military-connected children, I understand that many of us in the audience might not exactly know what that means, right? What is a military-connected child? Well, there are nearly 4 million children and adolescents in the United States that have a parent that are connected to the military in some way, right? That could be an active duty parent, that could be a parent that's in the National Guard or the reserves, or a parent that's a veteran. That's a lot of children. And these children are often called resilient. Why is that? These children are resilient because military youth face unique circumstances. And they live in a world, and they grow up in a world shaped by constant change. And these military stressors or these military circumstances can impact their family functioning, they can impact their social support, and they can also impact their mental health and their emotional and their developmental needs. And you might hear me say MEDB needs. And when I say MEDB needs, I can be talking about someone maybe with a diagnosis of depression, or someone with a diagnosis of anxiety, or autism spectrum disorder, or ADHD. The research tells us that these added stressors, like parental separation, relocations, deployments, they impact our military youth. And so individuals who are diagnosed with these diagnoses, youth that have mental health concerns like anxiety or depression or other psychiatric diagnoses, they feel an impact. And that impact is an increase in mental health challenges, rising from 9% in 2003 to 16% in 2015. And here's the problem. As our mental health needs rise for our military-connected youth, the workforce that has specialized training to work with these children is shrinking. There's simply not enough social workers, not enough counselors, not enough psychologists, not enough pediatricians, not enough psychiatrists who have this specialized training to help our military-connected youth or our national youth, right? So this problem doesn't just affect military-connected children, it affects all of our children. But when we think about it, for our military-connected children, it's amplified. And you might say to yourself, well, why is it amplified? Well, the reason is because in a study in 2022, researchers found that 74% of children and youth who were engaged in pediatric mental health care were receiving their care in the community. And why is that important? Right? They weren't getting that care on installation or on base, as many folks might think. What that means is, and why that's impactful, is if you are a military child and you have, let's say, some of those unique stressors that we talked about, frequent moves, that means that each time you move, you have to restart services and re-engage in services over and over again. So let's consider a family with a service member that's in the Army, and they're relocating, right? So they have a child who they've been waiting to get a diagnosis for, or at least an evaluation for autism, right? So they have an appointment for autism spectrum disorder diagnoses. They have their first initial appointment, and we know how long that wait might be. It could be anywhere from 6 to 18 months, depending on the case, right, or depending on the area. And this family, their appointment is in 3 months, and then they get their duty papers, and it's time to relocate. What that means is when they get to that new station and they have that PCS, they now have to wait another 6 to 18 months for that evaluation again, right? But that's not the only problem when we're talking about access to care for military-connected families. One of the other concerns is that there are many providers that are trained to work with children and youth, and they do have specialized care. The concern here is that they don't understand the cultural nuances associated with working with military-connected children. And that can be impactful. And the reason that can be impactful is because if you don't understand the cultural nuances, you might prescribe inappropriate interventions, or you might lack awareness of supports or resources available for these children and youth. And so now that we understand some of the critical gaps that are impacting our military children and families, let's talk a little bit about the solution. What is the solution? Well, in 2021, through congressional funding, the Military Child and Family Collaboratory was established. And this collaboratory is a dynamic group of policymakers, advocates, direct care providers, vital organizations, pediatricians, social workers, nurses, psychologists, university researchers, all coming together. And not only is this a place to come together, this is also a space And this space is an opportunity for these individuals to connect, break down silos, right? Thinking about systematic barriers, breaking down those barriers and having cross-sectional collaboration, and understanding that we all need to know what the barriers to care are, and we all need to come up with shared measures of what it is that we are deciding our outcomes for these military families. Not only are we coming together, establishing shared measures, connecting, doing research, coming up with research agendas, but also creating tools and resources for families that include technology. The aim of the collaboratory is to address those challenges that are faced by our military families, including treating youth across the globe, right? As I mentioned before, many of our families have multiple moves. Some can be what we call CONUS or OCONUS, right? So within the United States or in Japan, in Germany, in Italy, can be anywhere across the globe. We also want to make sure that we are working within the military system and within the community system. And in addition to that, we want to make sure that we are understanding and celebrating the importance of that collaborative care. And our goal is to build high quality access for the youth that we serve. So how have we done it? We have over 70 organizations that have come together. These organizations, again, are direct service policymakers, these are direct service clinicians, these are advocates, all coming together to do the great work set out to make sure that we are caring for our military families. We have had 6 convening meetings, and in those 6 convening meetings, we have been working towards identifying the access to care issues and identifying solutions. Out of those convening meetings, we've had the opportunity to develop 3 working groups that focus on research and focus on provider training and also focus on implementation of solutions. All right, so that's 6 convenings of experts and 3 working groups that come together monthly to actually do that good work. We've also developed program activities, right? And also made sure that we are including the families that we're working with, because we know that centering our families are going to be the most important thing to the work that we do. That's why our families are directly involved by sharing their perspective, giving structured feedback, and also making sure that they are a part of the process of program evaluation, refining, and giving feedback for the program activities. Collaboratory efforts like Project ECHO. Project ECHO is a telementoring and teleeducational model that we use to help train different providers. We also have digital resources for families so that we can give them support no matter where they are. And we also have been developing a family telehealth platform for our military families to get services no matter where they are across the globe. This collaboratory exists because military children and families cannot wait for systems to change. We can't expect them to wait while we figure it out. Continued investment in this program means that we stop asking our families to wait and we start to work towards change that is evidence-based and culturally informed that moves with the family. Sustaining this program is not just about funding a program, but it's also about investing in our nearly 4 million youth that are connected to the military and the families that support them. Thank you for your time.